When a patient comes in for a rhinoplasty consult, or if they're having nasal obstruction or both, the first thing we do is get a history, find out what the main problem is, what's their main concern, because addressing the patient's main issue is really the important thing. Once that's cleared up and once they're able to express what they want and what's been their problem, then an exam is done to clearly figure out what the problem is, look inside the nose, look externally at the nose, and then sit down and discuss with the patient what are the realistic things that can be done, what things may not look good or appear good or function well. Sometimes patients have changes that they want done to their nose that may not agree with the rest of their face, or may cause breathing issues. And so we have to sit down, discuss it, figure out what really is workable, what's really something that can be done and that will be fruitful and something that's pleasing for the patient. The nose is a very complicated structure. It's not only in charge of directing the airflow towards your throat and down into your lungs, but also humidifying it and making sure the airflow is not turbulent. The anatomy of the nose is made up of several components. The septum, which everybody's very familiar with, is the wall that divides the nose into two components, the two sides. On the side walls, there are two cylindrical structures called the turbinates that humidify the air. In terms of the breathing issues, we really have to figure out which portion of the nose is the problem and treat that issue and make sure that that is the only problem that's addressed, and not do too much and not too little for the patient. In terms of the rhinoplasty, being conservative is always good. Doing too much to the nose can get patients into trouble, because when you do a rhinoplasty, the nose scars over the period of several years, and if you do too much, you can get unpredictable results. So you have to be conservative and you have to know what you're doing and plan it in advance.